really began working with Carly Nelson as a construction manager back in, we went through a master's facilities plan back in 2010, and then we entered into a large 3-year construction project where we had, it was a very large, about a $15.5 million project. And we did hire Carly Nelson as the construction manager at that time, and it was a 3-year journey on that project, from everything from a new energy center to a new surgery department location, basically made it an ambulatory surgery area for our new surgery department, along with some renovation with internal, and that was a 3-year process. And Carly Nelson did a great job through that journey of 3 years, and through that time we saw success and we saw the benefits of that project, and so with that relationship we built rapport, we built trust, we built respect, and as a result of that, Carly Nelson being successful, we continued that partnership. And so with that, I always say past history is a good indicator of future success, and that's what we've seen with our partnerships with Carly Nelson over the years. I think that the benefit of the construction manager is they are knowledgeable in all the codes, all the different items that need to be completed for the owner, whereas the owner would have to be, we're very busy in healthcare, especially in hospitals. We have to be very efficient, very lean, and we have multiple projects going on at all the time. And it's nice to have, we know that we have someone working on our behalf, making sure all these things get completed as they should, making sure that codes are being followed, the contractors are completing things per contract, and that we're not missing anything to keep us always going in the right direction. And that is a value that is extremely valuable to us here at Henry County, especially as a smaller facility where we don't have all the resources to be able to do that, maybe that a larger facility would have. They really do bring great value to us whenever we have a big project. Yeah, we've been working with Carly Nelson on this most recent project as our construction manager, and they've done a tremendous job. And we started the project approximately about 1.5 years ago, before the pandemic hit. And our project has entailed renovation of a medical office building, and then also entailed a new pharmacy location for our pharmacy department, a new location for our central sterile department, along with putting in some new air handler units for within the health center. A huge amount of appreciation and credit goes to Carly Nelson and their team. Really want to thank them, because when the pandemic hit, it first started, we implemented the necessary testing and screening for staff. We, in terms of testing to make sure our air environments were good, and making sure screening that people were screened, they didn't have fevers or any symptoms, and then when the March date came along and the pandemic intensified in 2020, I worked with Carly Nelson, their leaders, along with the contractors, to pause the project. And so we actually paused the project for a period of 3 months. And then we restarted 3 months later, and to restart with making sure, requiring all the contractors to wear the appropriate PPE, keep them safe, screen in every day, and make sure that they're keeping themselves safe as contractors, but also to keeping our staff and our patients safe, and visitors who are within the health center here for services. So the project was lengthened, obviously, by that period of time, that 3 months, but as we came back together at the time of June, we also reviewed the project and the scope of the work, and were there any additional new features or safety items that we needed to add, such as glass for registration desks to keep the registration person safe versus when they interact with patients. We added some of those features throughout the project where necessary. They're incredible. I really want to recognize Chris Smith, Alan Schock, and Chad Sawyer. Chad was our site superintendent. Alan was the project manager, and then Chris was the executive on the project, and just a great team. And they have very good relationships with our contractors, along with our maintenance team. Our facilities director, Brian Sinclair, worked closely with our architect design team from Envision, along with our engineer from Modus. And so that's the key of always working with Carly Nelson that we have found, and that's why we continue to work with them. They are a great extension of us as the owner, but also too they work so well with the contractors and the design team. They're very effective at everybody seeing the big picture and how do we get the project done to serve the community. So that's what I like. They have similar values. Carly Nelson has similar values as Henry County Health Center, and how we work and how we treat people and how we treat contractors, and that's why we enjoy continuing to work with them. And every project we work with them, we finish on budget and usually on the schedule. They couldn't control the pandemic, but we were on schedule to be completed on time. So I would recommend Carly Nelson as a construction manager for any public hospital in the state of Iowa that is looking at utilizing a construction manager for their work. The reason for that is because they truly they get to know the owners, they get to know the team, they work closely with the facilities team. They're an extension of the facilities team. They really want to make sure that everything is being done on behalf to serve that community, that local community, and what benefits the owner, but also to the patient and the families we serve. And so you really see that in the people that work at Carly Nelson. They present those values on a daily basis along with their leadership in making sure the projects get completed as we can to serve our community.